Weighing and measuring a baby. If the baby is under 6 months old, they should be weighed with no clothing on, including the diaper. But you would wait until the last moment to take the diaper off. Now, the safety is, I've already had done a hand hygiene. You want to make sure that you have, that you keep one hand at all time over the baby so that there's no chance of falling. They are very quick and they fall off surfaces before everybody is ready. So you never leave them alone. If you forget an item, forget your tape measure, your pen, then you pick up the baby to go to get that item. Now, if I'm measuring the baby on a measurement device as this, I've got this baby undressed. I'm going to put the head all the way at the end, stretch the legs out so that I get the longest possible length. Make sure that the foot is flexed so that you are doing it from the bottom of the foot. But when you keep pulling on the leg, making the baby straight, you want to make sure that you haven't moved them out of their position at the head. This comes all the way up, and I get 46 centimeters on this baby. Now, you may not have a device like this. You may be getting a quick measurement. Not as accurate, but it can be fairly accurate if you're careful. That I can use an exam paper. Don't do this on sheets, things that can't be fixed. I am going to take my pencil, mark on the paper at the top of the head, and mark again with the foot, and make sure again you're not pulling them out of their position. When the baby is moved out of the way, then I just need to measure to get a good measurement of the baby. And it's again 46 centimeters. So if you're careful, it can be fairly close, but you have, most of the time, it's a lot more accurate consistently to use the other type, some kind of device to help measure. If I want to do a head circumference, then I would, and those in between, I keep the baby wrapped. So the babies don't like being measured, they don't like being on hard surfaces or bouncing surfaces like scales, and they get upset. We want to keep them less stressed and calm so that if you're doing measurements before a physical, the baby will be relaxed and calm. When you are measuring a head circumference, and this should be done during all measurements until they're 2 years old, you would go over the widest surface over the brow and to the widest in the back, and so that it's in straight alignment. Use a disposable measuring device so that you have a clean one for each child. If a lot of times it's the paper tapes, this one has a measurement that you just read where it falls the line, and you can just pull it tight. But you need to check below to make sure when the baby hasn't wiggled and moved, that it hasn't moved up here or moved down below, that it's still straight. It's very important to get these measurements accurate. And if you might have to do a couple times to make sure you have the correct measurement. So this baby's measurement is 33.7 centimeters for their head circumference. Now, I'm going to measure their weight. So with the scale, make sure that they have that you have a paper, a clean paper for the baby, or a chucks, or a receiving blanket, or whatever you're putting on the surface of the scale, that you have put that on first, then you get the scale balanced to 0. Similar with doing adults. If you're doing a scale, you put paper down before they step on it, make sure it's on 0 for the measurement. Now, I said I'd wait until the last minute to take the diaper off. that I've unwrapped them. They may be upset, so loosen the diaper. If they have to urinate, wait. Sometimes when you have the cold air hits, they will urinate, so hold a minute and then remove the diaper, get your weight, and then you'll put the diaper back on. And wrap the baby up to give to the parent, guardian, or if you need to hold them before they're getting their physical so that they're calm and relaxed. You can do another measurement would be abdominal measurements that may occur, which is similar to the head. It's over the umbilicus, so that when they're measured, that you're sending the tape measure across the widest part, and that you're consistent. You mark where you write down in your notes where you're measuring it. Like this baby is 32.4 centimeters for the abdominal girth. That's not one of your regular measurements that may be done depending on the medical condition. Thank you.